Okay, it has been a long day. I'm going to give you the opportunity, but I'm not going to push you. If you'd like to ask a few questions of Dr. Clark and Dr. Payne, they're going to be up here. We have a mic that'll be here, but we're not pushing you to do it. But if you have a couple of questions and you want to ask publicly, this is the time to do it. And while we're waiting for the mics, I will mention, and Dana has a mic over there. Dr. Payne is making his way up. Another physician that I greatly admire besides these two gentlemen is Dr. Martin Lloyd-Jones, who was also a pastor. It's interesting that in his commentary on 1 John, he opened the entire commentary with a verse at the end of 1 John chapter 5, and he reminded us that the whole world lies in the power of the wicked one. And much of what Dr. Clark has said tonight and Dr. Payne fits that 100%. So any questions?
In the case of, I guess a zygote embryo being implanted in like a fallopian tube and endangering a woman, when I've had conversations with other healthcare workers, honestly, that's like something they'll bring up, and that justifies abortion. How would you answer that question?
I'll give that easy one to Dr. Payne.
I didn't get all of it.
So when an embryo is like implanted in a woman's fallopian tube and it's not viable and it's endangering a woman's life, in that case, there being an abortion taking place to save the wife of the mother, like how would that even be written into legislation? We talked about exceptions tonight, and there can be no exceptions. Some people who argue.
Are you asking, are there exceptions where the baby will need to be taken?
Yeah, like if a baby implants in a woman's fallopian tube, it'll kill her, like if it goes full to term. Or like she's hemorrhaging out, like in the fetus.
So you're talking about an ectopic pregnancy,
yes,
basically.
Sorry.
Yeah, right. So the idea there is that we make a distinction between intentionally killing a child and delivering a baby. Right. And so
an ectopic pregnancy is not going to live anyway. So, and it's the mother can die like that from the bleeding. So it's if it's discovered early enough.
So in that case, abortion of that baby would be okay. Would that be like written into legislation?
Right. So there's always good life of the mother legislation that's present, or language that's present in any good legislation. I've seen literature regarding ectopic pregnancy that brings into question the current practice established by the American College of Obstetrics and Gynecology. That could show the roots of a hatred for life in the development of that set of standards. And I think it's another area where, for example, a Christian OBGYN who studied this and looked into the roots of the literature would understand that there's a lot more to the story. There's other literature that's available. But the way it's been put together in America, what we've been taught here is that it is an immediately life-threatening condition demanding input either through methotrexate or through a surgical procedure. And I think just what we would say is that we would have to see the medical proof that methotrexate is required at that moment. We'd need to make these scientists prove it to us. Because there are cases of ectopic pregnancies that have survived.
Lady in the back that wants to say something.
That eventually came out of the fallopian tube and made their way into the uterus. So it's a much more complicated situation than what's being presented. But most residents are taught that it is an immediately life-threatening situation every time, all the time. But that you can even see that's not true when you look at the standards in terms of methotrexate versus surgical inputs and the options that the surgeons have available to themselves at that time. But the language would say that we would distinguish between delivering a child and killing a child. Delivering a child early, you're not intentionally killing the child. Okay, and the child's going to die outside the womb. We know that, but maybe not in 50 years. I mean, the point is, it's marching backwards all the time, viability. It's getting younger and younger now, viability is. And so we don't know what's going to happen in the future. And so we need to encourage our obstetrics and gynecology brothers and sisters in Christ to really dig into the literature and to really study it and to think ahead and think in terms of that human being made in God's image and not doing anything to threaten the life of the mother, but to be able to sort through that situation in great wisdom. I think it's been oversimplified. That's my opinion. And I'm not an OBGYN, so I'll probably get 1,000 phone calls from OBs, and that's okay. But, as a result of my work with personhood, I've read a lot about what their standards are and other literature that's available and other forms of therapy and how fast it becomes lethal and things of that nature.
We have a question in the back right.
No, she's not.
Okay, I just wanted to add, I think the first thing we have to do is to define what an abortion is. An abortion is the intentional killing of a child in the womb. And, excuse me, abortion, well, first I want to say that the APLOG and the Denmark Declaration has over 2,000 physicians who have signed it saying that abortion is never necessary to save the life of the mother. And APLOG also has that position. And the reason is because an abortion never saves the life of the mother. Medical treatment does. And if in the course of giving medical treatment, the child unintentionally dies, that is not an abortion. Yeah. You have to differentiate. We have, as Dr. Clark said, we in America have been herded into thinking that it is necessary to kill the child, willfully, intentionally kill the child in order to save the life of the mother, and that is not true. So we have to define our terms, and we have to.
It's a really good question. We always have to be very careful with the language that we put into the laws. And so we have to be careful. Because the very last thing we want to do is put physicians in a spot where they can't feel like they can take care of a sick patient.
If we define personhood as, and I guess if I understand, you're defining it as the point of fertilization. The question I have is, in your discussions, really more within the church, is the church ready to deal with the fallout that comes from that? And I'm dealing more specifically with the use of hormonal types of birth control that induce aborticides about a third of the time. As many Christians as non-Christians use the birth control pill. And there are times that, I guess about a third of the time, you abort the fertilized egg. We like to talk about it, but that's a reality. But if we move forward and define, or we write legislation that defines a person at that time, that's a discussion as a church we have to have. Are willing to talk about it. Because in all the years I've been to church, I've never heard one sermon about birth control, family planning, or any of this. We've walked away from it. 50, 100, 200 years ago, it was talked about. We don't talk about it. And I was just curious, because this is your lane, what kind of conversations come up about these kinds of issues?
Is the church ready? And specifically the contraception angle, that it would be the question about contraceptives being abortifacient. And is the church ready to deal with that?
I'm not getting the gist of what the question is. I'm a little hard hearing.
Yeah. Well, I'll say that I don't think the church is ready for that. From what I've seen, I don't think the church is ready for that. From a legal angle, you really can't prosecute a crime if you can't find a body. And so in this particular situation, there's not going to be, in most cases, any way to prove that the woman was pregnant. And so there's nothing really legal there about that, as best we can make out. Now, there might be some attempts that you can make legally to, talk about potential threat to potential human beings, and like if you shoot into the woods, you shouldn't do that because there could be somebody in the woods. So there's potential for legal action there, but if there's no body, it's really hard to prove a crime.
Well, and I understand that, but as believers, our judge is not going to be the civil authorities.
Yeah.
We stand before God.
Sure.
And as we continue to use, we abort, through, a traditional abortion, through aborticides, morning after pills, we're using them in the church, and we don't talk about them.
Yeah.
And we're attacking non-believers in the civil authorities, trying to use civil law to control out there. But what about our own house? When are we going to have that conversation, and will we ever? Just a thought.
I agree 100%. I think it's a theological problem. I mean, a lot of Protestants are going to look at me like I'm crazy, but I think if God had intended for us to enjoy the marital union, which is what we should call it, it can occur outside of marriage. But if we're going to enjoy it, He made it a certain way to lead to fruitfulness. And I can't find anywhere in the scriptures where it looks like it's wise or even allowable to intentionally try to keep that from happening. So the separation of love and life objectifies women and leads to all hosts of problems that we have in our society. So I think the conversation goes back even before the abortifacient aspect. I mean, even if we could design the perfect birth control that really never was abortifacient, I still think there's major theological issues that we bring to the forefront that we as Protestants have just been sold down the river, I think, on that one. I think we need to step back and see that birth control objectifies women and men too.
If anyone else have a question, please raise your hand. Okay, well, thank you for your attendance. Enjoy your rest tonight, and we'll look forward to seeing you at 9:30 sharp.